Hey, how you doing? Happy New Year.
Happy New Year.
All right, so good. Hope the holidays went well for you. As usual, thank you for following along. And I always appreciate comments, and if you hit that like button and you want to comment, go ahead and do that. Today's video is entitled The Fastest Way to Get Well. It really is. And this will be interesting. This is actually going to be part of a number of blogs that are going to be real medical oriented, not medical, but health oriented, and things that you can actually do to really take care of yourself. And it's not a whole grocery list of things. It's basically one thing to look at. And once you've got that, you've got it. Good. So when a patient comes to see me, I try to deliver the care that I would want if I were that patient, knowing what I know. And I'm the one that's laying on the table, if you understand how that is, right? So, and I mean, that just sounds like the right thing to do. But the reason you have to do that is just because a patient's standing here in the office and saying that my this hurts or my that hurts, you can't assume that they know why it hurts or that's even what the problem is, right? You would think, because I'm a chiropractor, if somebody comes into my office and they've got low back pain, well, it must be a musculoskeletal problem, right? Maybe. Could be any one of a number of things. And if you just assume that the patient knows what's wrong and what they need and all the rest of the stuff, you might be asking for it.
Could be a dietary problem causing, an inflammatory response throughout everything. Could be a, plain old musculoskeletal problem. Could be them just trying to get away from their spouse or something like that. I mean, it could be anything.
Yeah. And the other thing is, usually the first sign that somebody is aware that something's wrong is so far downstream. This has been going on for weeks. Usually when somebody's back blows up, I ask them, I said, let me ask you something. For about the past 2 weeks, when you got up out of a chair, were you kind of a little stiff and bent over a little, but then it went up? Oh, yeah, that was your warning sign. Oh, that? Yeah. So what brought you in here? I can't feel anything from my waist down and I can't walk. And that's the first sign? No, I don't think so. So, good. Now, the problem is that with a lot of these conditions, especially with the low back, there's a history of degeneration, inflammatory things that are going on that predate all of this. That there was a degrading process that was going on where the collagen was being broken. There's an enzyme and an immune response and everything else, and it just destroys the tissue. And once the tissue has been destroyed enough, that alters the function or the mechanics of the low back, which then leads to a disc herniation and any one of a number of things. So the person wants that pain to go away. It's like, good luck. Yeah. If we could just take a little camera or something and look at this back, and you could see how roughed up and how destroyed and all the rest of the stuff is, you'd be surprised that you were even able to walk into our office, or that you were ever going to heal and recover. Yeah. And that's a testament to the body's ability, because these aren't like I pulled a little muscle. Mm-hmm. Oh no, that's so far down.
Yeah, you pulled a little muscle probably a couple months ago, and then you kept pulling and doing this and that. It's as we kind of say, if this internal problem was external, you'd be wigging out and probably wanting to go to the hospital. It would look pretty rough.
Yeah. A lot of the medications that people take for back pain and stuff, they don't actually, people think, oh, it's going to handle the back pain. No, it just makes you not notice it.
Yeah. Problem's still there.
It's still there.
Yeah.
And it's like, yeah, you're standing outside, you're trying to walk into your house, and the fire department says you can't go in because the house is on fire, and you're like, what? How? What?
Yeah. It's like cleaning up your room, and you just shove everything into the closet and close the closet door. It's like, hey, no mess. It's like, no, mess is still there, man. You just kind of are ignoring it.
Yeah, it's very true. And that's the thing, unless that chronic inflammatory condition is resolved, you're probably never going to get better. It's just going to get going and going and going. And the thing you have to keep in mind is that chronic inflammatory problem, and you're thinking, oh, this is just a back. No, that's how it manifests itself. That chronic inflammation can branch off or become the start of any one of, I think they said there's over 10,000 different diseases and maladies. So perhaps you got lucky that your manifestation was a back pain when it could have just as easily been a stroke or some sort of cancer or a heart attack or something else. The mechanics are the same, these inflammatory processes. And there's certain types of pro-inflammatory mediators that you'll see with this. One set's called pro-inflammatory cytokines. And when those are elevated, they say they don't damage, they actually destroy heart tissue.
Yeah.
Destroy it. So when your back is all wigged out like this, guess what's elevated? The pro-inflammatory cytokines. So thank your lucky stars if it's just a back pain and it's not a manifestation or just one of the things that's where the tire decided to blow out, if you understand what I'm saying. So yeah, and that's basically it. So, all right, let's see. I've been going off script because it works best that way. So here's the question. What if there was one thing, you know, when they tell you to keep your eye on the ball, if there was a ball that was related to your health and your wellness, what would that ball be? What would be that one thing if you could change your lifestyle and really focus so that your waking hours were spent resolving this and your sleeping hours were spent recovering from this particular situation? What would that be? Blood sugar. Blood sugar, blood sugar, blood sugar, right? That would be the thing that you would want to work on. As a matter of fact, I say right here, if a person spent his time managing blood sugar, I dare say he would be doing his best to prevent contracting every disease and disorder known to mankind.
You got to think of what your blood vessels are. I mean, they're the delivery system of your entire energy system. And if those are messed up because of high and low and falling and crashing blood sugars, which is what it's going to really mess up those arterial walls. Yeah, your whole energy delivery system is messed up, and every single tissue is going to be affected negatively.
Yeah, blood sugar is part and parcel of everything that would ever negatively happen to you, and it's also, we control it, it's part and parcel of all the good things that would happen, your health and your wellness.
Absolutely.
You really would just be, working on anything else, like the biohacks and taking testosterone and getting liposuction and the Ozempics and all the rest of the stuff, and doing the magic mushrooms and microdosing LSD and all the rest of this crap. No. Gummies, what else is out there? The medical marijuana. No. Blood sugar, blood sugar, blood sugar, blood sugar. The blogs that are coming up after this, that'll be about, maybe 4 or 5 of them, we're really going to start to talk about that. What would a person do to handle their blood sugar? Diet. You would eat correctly. We can show you how to do that. You would exercise. We can show you how to exercise correctly. We can also show you and talk to you about the right way to sleep. Sleep is another major thing that you can do. And the other one that everybody misses, which I find very interesting, because it's the whole point of everything, enjoy being alive.
Actually have some fun.
Have some fun, your social interactions, the people that you hang around with. My God, if you're hanging around with people that just drag you down all the time, no wonder you feel like crap.
Yeah, don't be confused as to why you don't want to get out of bed to hang out with those same awful people. It's like, oh man.
Find new friends.
Yeah, have something enjoyable.
But your social interactions are a huge part. Your health is based on how and what you think, what's your mind, and how you respond to the world around you. All right, so we're going to leave that at this for today. And like I said, if you want to, come on in and we'll get you started on the blood sugar and showing you how to do this. Best part is, there's nothing to really, there's no products or anything else. As a matter of fact, I just got done listening to a seminar that said medicating diabetics is actually a waste of time. The medication doesn't work. The diabetes is a huge problem. It keeps you from being healthy.
Keeps you from healing. It keeps you from doing. Yeah, I mean, it's a horrible thing. It's pushing the mess into the closet and closing the closet doors. It's not handling the problem. It's handling maybe one or two of the symptoms. And
Right. So if you're trying to fix things on top of diabetes, I was like, well, I'm pre-diabetic. Well, we're all pre-something. We're all pre-dead. It's a stupid diagnosis. Did your doctor actually show you how you could go from being pre-diabetic to not diabetic, or is he just going to sit here and bide your time until you need pills? I mean, think about it. It's stupid. So, good healthy food, exercise, sleep, and hang around with quality human beings that you enjoy.
be joyful. Yeah.
Yeah, be joyful. You got it. All right, so we're going to leave it at that. If you think about it, hit the like button and subscribe and tell all your friends about this. And do try and catch all these next 4 or 5 blogs, man. They're really amazing.
It's a bit of a series. And comment something that like actually brings something joyful to your life. To, let others know how you're enjoying your life, and let us know.
Yeah, I'd love to know.
Yeah. See ya.
All right, take care. Have a good day.